Welcome back to Morning After, everyone. It is 10:15 here on this Tuesday morning, and a fascinating topic. Fewer black men are applying to medical school, going into college with the intention of becoming doctors. What accounts for that, and what difference could it make in minority communities if there were more representation? Dr. Dale Akorodudu is joining us now. He's both a doctor, and now it turns out he's a filmmaker as well, because he's documented this in a new documentary, which we'll talk about in a moment, Doctor. But let's first establish here some of these numbers. What stands out for me: fewer black men applying to medical school in 2014 than in 1978. Why is that?
Well, first of all, good morning, and thank you for having me. It's a variety of reasons. It goes from things like the MCAT standardized testing that's hard for some people to actually get the resources to perform well on, to the way they're educated from, 5 years old and on, academic preparation, to interest and exposure and wanting to go into the field of medicine. There's so many different reasons, but the good thing is all of them are reasons that we can tackle and take on.
Yeah, and you do that in this film, again, which we'll talk about in a second. I find this interesting as well. So while the number of black men on the path to become doctors is diminishing, the number of black women is increasing, and there's an effort overall to get more women inspired to get involved with science and medicine. Do you think that accounts for that?
Definitely 100%. So as you mentioned, you have certain efforts to get more women into the field of STEM, but there's never really been an effort to get more black men into any STEM fields per se. But the good thing, again, is there's resources out there, and you have a lot of people right now who are actually willing to make that effort and to make it happen. So, hopefully we'll start to see these numbers come up in the next few years.
A lot of people might look at this and say, why is that important? If someone is setting out to establish a career and they're successful and they choose this pathway as opposed to medicine, what difference does it make? Well, the difference is in having representation of minorities in the minority community, because black men have the lowest life expectancy, and we also know minority communities have an inordinate number of people who have underlying conditions, from hypertension to diabetes, etc. Does it make a difference if someone of color goes to the doctor and they see themselves reflected back?
It does, and I want to make sure I'm clear. I'm never saying that because I'm a black doctor, I can do a better job taking care of black patients. That's not what I'm saying, but we do have the data out there to suggest that specifically for a black male patient, if your physician is also black, you're much more likely to actually listen to and adhere to their preventative recommendations. So things like getting your sugars checked, getting your cholesterol checked, vaccinations, you're more likely to listen to that if your physician is also black. So that's where it makes a difference. And I would also like to just say, COVID is a perfect example. So you look at COVID right now, COVID is a perfect example as to why we need more diversity in healthcare, because although it's disproportionately impacting certain underrepresented communities, we're seeing the impact on everybody across the world now.
Yeah, it's basically amplified what we've already known in a way that has had deadly consequences. And so let's hope it shifts the conversation. So you started Black Men in White Coats, and you've put together a documentary as well. In doing that and in telling this story and in uncovering how this is happening and what the positive effects moving forward could be of more black doctors, what did you learn yourself? Would you say, what did you walk away with?
I walked away with a greater sense of empowerment and an understanding that other people wants to help and other people wants to be empowered. That was really the big thing for me that made me feel good. We put the film out and the feedback we're getting is amazing, and we're having conversations with medical schools, hospitals, libraries, and everybody's walking away with a sense of, hey, I can help, I can do something about this problem. So that's my takeaway. It's a team effort.
All right, so you mentioned this on the front end of our interview, and I think we can bring it full circle to that. This, to me, reminds me in so many ways of the Oscars So White movement. What we determined there was, and what Jane Fonda even said the other night is, it comes from the top down in a lot of ways. There needs to be representation at the top. If the heads of medical schools are white, if professors are white, and if on the elementary, middle, high school levels, black children aren't being told you can be a doctor if you'd like, or here's an introduction to science, then none of this is going to change. Doesn't this take a concerted effort from the top down?
100%. It does take that effort. So it all starts with the leadership. The leadership has to see and understand the importance of what we're doing. This impacts everybody, not just Black men. And again, the positive here is as people are watching this documentary, we're having CEOs, presidents, deans reach out to us and tell us that they are determined now because they've seen the film and they actually want to contribute to making a change here.
Well, let's talk about the documentary on a final note, how people can see it. The other thing I love about this age in which we live is you don't need a movie studio, you don't need a cable channel. You can post your documentary and people can see it. So tell them how they can see it.
Yeah, thank you. So you can access the film at bmwcmovie.com. And actually what we've done is we've actually built our own screening platform called indiescreening.com. So you can go to indiescreening.com and actually host large screenings for 300, 2,000 people.
So let me get this straight. You're a doctor, you're a filmmaker, and now you're a tech guru too?
Yeah, we try. I have a good team around me, a good team of people who help get all this stuff done.
I was going to say, don't spread yourself too thin here. You got lots of patients to see and a lot of work to do out there. Dr. Dale Okorodudu, thank you for joining us.
Perfect.